Here's your lymphatic routine to work your C-section, your tummy tuck, any abdominal surgeries, and also if you haven't had a surgery, if you're dealing with PCOS, with endometriosis, with bloating, anything struggling in your stomach area, this video is for you. So we are always going to start by opening up your 7 major lymph nodes first, and then we will lay down and work your stomach. So place your hands on top of your chest. Let's do tiny downward pull of the skin. And it's a very light skin stretch down. Our pressure that we always use is the same as if you were working on somebody who is sleeping, and don't wake them up. This is not aggressive work. This is extremely light. It doesn't matter your size, your age, your body fat, your muscle. Your lymph is right underneath the surface of the skin. Don't go deep. Even when we work your tummy, go light. All right, that's spot number 1, make a peace sign. Let's do a finger in front of your ear and a finger behind your ear. We're going to circle the ears and pull down. It's a circle and a pull. So I'm already starting to feel some salivating in my mouth. I'm going to swallow in just a moment. You might feel some drainage at the back of your throat. You might hear a tummy gurgle. You might get a yawn, a sneeze, a cough, an itch. These are all signs that your lymph system is starting to move, and also that your nervous system is switching out of fight or flight and into what's called parasympathetic. It's known as rest, digest, and heal. And that's why we get tummy gurgles. That's why we get yawns. These are good things. Okay, spot number 3, where your jaw meets your ear just on the neck, really soft circles there. Super light. I'm not digging into the muscle. I'm not massaging. This is not a massage. So a lot of people call it or refer to it as lymphatic massage. This is called manual lymphatic drainage. If you're looking for someone in your town, your city that does this work, if you want to go get treatment done on your body, a lot of massage therapists offer this work, but this is a completely different modality. It's called manual lymphatic drainage. So look for that. And even better, if they're oncology and post-op certified, you know they have really good touch, because this work you cannot do aggressive on somebody who's going through chemo or if they just had surgery last week. It has to be done properly with medical attention. Lots of swallows for me. All right, next spot, underneath the arm. So I just take my hands into my armpits. I do little circles, it's like a massage here, right? Super soft though. I just think of stretching the skin and circling the skin, because I want to get away from the word massage, because this is completely different. Okay, that's spot number 4. If you have had any breast surgeries, if you've gone through breast cancer, or even cosmetic, like a breast lift, a breast augmentation, a breast explant, you've had a mastectomy, a lumpectomy, anything going on in this area, I have a chest video in my playlist that's really great, just focusing here. All right, next spot, where your diaphragm and your ribs meet, really soft on the skin, little circles here. So if you look down, I'm going clockwise. That's just a good habit to get into. It doesn't matter so much right here. It's a really small movement, but if you were working your whole tummy, you always want to go clockwise. So just get in the habit, look down, go clockwise. Save yourself down the road. Clockwise helps you with constipation. It's the direction that we are digesting our food and moving our food through our intestines, and then everything will exit. Your colon is on this left side. Okay, I'm getting lots of swallows. Maybe you are too. So next spot, we're going to the groin. So halfway between hip bone and pubic bone, little circles here. This is why sitting down a lot is so detrimental to your lymphatic system. It's because you sit and you cut off the flow. And so maybe your hip and your back pain has nothing to do with muscle or bone. Maybe it has to do with lymphatic flow. And our brain only talks to us a few ways, and one of them is through pain. So if you're experiencing pain, don't automatically assume muscle and bone. I always think blood flow and lymph flow first. Move the lymph, move the blood, maybe the pain will go away. All right, the last spot we're going to work before we lay down is behind your knees. So it's just this little knee pit back here. I just lean down and circle behind my knees, super soft. And I'm just doing little circles back here. Okay, we've got all 7 open. Let's come lay down. This is a longer video. If you want a short video, I have lots of short ones, but I wanted a long one for you guys today. So once you're laying down, we're just going to work on the upper half for a little bit. The main focus will be down here. I'm going to use the seam right here as if this is my C-section or my tummy tuck scar. And then even if you don't have this scar in particular, this will help your lower belly with other situations like PCOS, endometriosis, bloating in general, if you've had hernias, if you've had any other surgeries in your tummy, working this low line, because this is where the lymph really gets stagnant, especially in us women, we get that lower belly. So starting at the top, this is where my ribs are coming together. And right here, really softly, I'm going to do little circles again on this major lymph node. Her name is Cisterna chyli, and she sits right underneath our diaphragm, and she's right next to our vagus nerve. Our vagus nerve runs down through here and then branches into our stomach. So we want to be really soft to Miss Cisterna. I had a comment the other day that said she thought I said Sister Kylie, so we can just call her Sister Kylie. We'll do about 10 circles there. We're going to say hello to your liver and your spleen. Liver's on the right. So take your opposite hand, reach across on top of the rib, skin stretch, ease off, skin stretch, ease off. And I want to be extremely soft with my touch. Again, the lymph sits right underneath the surface of the skin. It doesn't matter your size, your weight, your body composition. The lymph is in the same place for everybody. We don't need to go deep. Let's make sure that we are drinking water with electrolytes, especially with working your stomach. Sometimes this can make you nauseous. Sometimes this can make you dizzy. So if you get dizzy, you need electrolytes. You are dehydrated. If you get nauseous, it could be the combination of needing electrolytes. We're going to go a little bit wider. I wrap around the side of my ribs. I pull in, ease off. Man, there's lots of fuzzies on this sweater, isn't there? That's super cute. All right, back to your electrolytes. So if you get nauseous, sometimes it could be electrolytes, but also sometimes we are recirculating toxins into your bloodstream. And the more toxins that are sitting dormant and they start to move, sometimes this work can make you nauseous, especially if you've had a lot of surgeries, if you've been really sick in your past, if you've taken a lot of medication, if you drink alcohol, if you eat sugar, all of our lifestyle and our past experiences get stored into our lymph. I've just come a little bit closer to move that skin towards Cisterna chyli. So just know, if you feel nauseous, it could be the toxins moving. Let's make sure you're drinking lots of water and electrolytes. And I'm just stretching the skin. It's super, super soft. It's so light. I use the same pressure on my hand. Skin stretch, ease off. Skin stretch, ease off. Let's do this side. Your left side is your spleen. Remember, we are a mirror image of each other. So hand on top of your rib, skin stretch, ease off. And I wanted to show you guys on my skin. Normally I'm showing you over clothing, but I wanted you to see just how light my hand can be. Look, I don't have to grip at all. Just my palm can maintain that contact. And I want to make sure I'm not going back and forth. I'm only going this way, and then I ease off. Only going this way, ease off, because everything needs to come up to Cisterna chyli. Skin stretch, ease off. Skin stretch, ease off. These are super gentle. Your spleen helps produce your white blood cells, so she's super important to fight illness, your immune system. That's why if you are diagnosed with cancer, your white blood cells are through the roof. Your body is trying to fight something. I'm getting lots of swallows. We'll come in a little closer. So for me, I wanted to do this video for you guys today because I've been having some low belly pain. My endometriosis is a little cranky and I've been feeling really bloated this week, and I shouldn't because my period's gone. This is the week I usually feel the best and I don't feel that great. So I wanted to see if doing this video with you would help my tummy as well. I took a before photo. I want to see if the bloating goes down in my low tummy when I'm standing. Okay, so I have longer videos to work this area. The bloated stomach video, I work this area a lot more, but we're going to spend more time down here today. So everything from down here needs to come up. I'm going to start to one side and just place my hands on my tummy and pull the skin up this way. So starting up a little bit higher, like in the upper part of my pants, skin stretch up, ease off. Skin stretch, ease off. Pulling up, ease off. And I just gently, slowly make my way closer to my hip bone. I'm always aiming up this way because this is home base. Everything needs to come here. And yes, so we have lymph nodes. Right here is my groin, my inguinal lymph nodes. But if I push everything down here, it has to come back up here anyway. So all of your tummy needs to come up. Once you get to the hip bone, do a little skin stretch off the bone and ease off. And even if you can't quite feel the bone, just work right over that area. There's a lot of lymph nodes right along here, along your bikini line. Ease off, skin stretch, ease off. I'm going to retrace my steps back up. Ease off, skin stretch, ease off. And you can do this over clothes. You can do this on your bare skin. I can get more of that skin stretch pulling up on my bare skin, but over clothes, it works perfectly fine. I recommend doing this without any oils because if you have oils on, you're going to slip. And so keeping that light contact, that magnet feeling on your tummy. I've lost 80 pounds twice, so I have a lot of loose skin. It moves a lot. And so your skin might not move as much as mine does, so don't take that into account. I want you to feel what feels good for you. So we've done this line. We're going to do this line now. Starting at the top, skin stretch up, ease off. I am not pushing in heavy at all. Skin stretch up, ease off. And again, if you're doing that on your skin, you can get a better contact. Skin stretch up, ease off. You can even do it like this. Play with your hand positions. Just do what feels the best for your wrists and for your tummy. I want you to make your way all the way down to pubic bone. So if you do have a tummy tuck or a C-section scar, usually it's a little bit lower than my seam. It's about right here. You'll start to feel some movement with that scar. I'm getting lots of swallows happening. If you do feel nauseous or dizzy while doing this, pause the video and go drink your water and electrolytes right now. Don't wait. All right, let's come back up. So for me today, right where my hands are, where I'm having all my pain, all my bloating. So if I was just doing this for myself, if I wasn't teaching you how to do this, I would spend more time where I feel my pain and my bloating, which is right here. So if you find a spot that feels more painful, more bloated, a little more hard, a little more gurgly under your fingers, spend more time there. This is your work. I'm gonna come back up to Cisterna. I'm just pulling up. And now we'll do this line. So think of it as like 3 down here. We've got the diagonals and then the down. We're gonna do this one over here. Skin stretch, ease off. Skin stretch, ease off. Super, super light. And again, if it was on the skin, just as light. This can be done morning or night, empty stomach or full stomach. I do a lot of lymph work if I eat something and it upsets my stomach. If I get bloated right away, if I get pain, I can't eat gluten and dairy. It makes me feel pretty sick. And pretty immediately I get stomach pain. So I will go lay down and do this. If I eat it and I'm out in public, I'm walking around doing this standing up if I have to. I'm just making my way down to that hip bone. Pull up, ease off. Pull up, ease off. I'm just retracing my steps. So think of all of this as just the initial, you're saying hello to the lymph, you're getting it moving, you're making everything come back up towards the sternochyli. She's right here. We'll pull her all the way up. And then let's do our circles at cisterna to make sure she's moving. Lots of swallows for me again. All right, now we're going to spend some time along the C-section scar, your tummy tuck scar. And even if you don't have this scar, I don't have either of those scars, but this works for my tummy as well. So starting on one side, doesn't matter which side, I'm going to take light fingertips and place my hands right along there, almost like they're walking on a tightrope. And again, I don't have this scar, but I'm going to do the same thing. So taking my hands there like a little tightrope, I'm first going to go this way, then this way, side to side, this way, and this way. It's super subtle. So if I'm working on my skin, this way, this way. I'm not sliding on the skin. I am glued to one spot and just stretching the skin right and left. And we'll do about 10 just in this one spot. And this way. Across and across. I'm actually going to do this on my skin because it just feels better. I'll do it with you. Out and in. Let's try one more for each side. Just pretend I'm on a C-section scar or a tummy tuck scar. Or if you have neither, just do it on your skin with me. Okay, come a little bit more to the middle. Same thing. Right and left. Skin stretch to the right. Skin stretch to the left. Sorry that we are a mirror image. Stretch, hold. Stretch, hold. Stretch, hold. Stretch, hold. Let's try one more each direction. Okay, next spot. Stretch, hold. Stretch, hold. So what this is doing is getting lymph flow into the fibers of your scar. Your scar becomes pretty dense and layered. Fascia likes to stack like this. And when you have scars, this starts to happen. And then it's harder and harder to get blood flow and lymph flow through that fibrous tissue. So this starts to help. Don't think of breaking up scar tissue because breaking isn't something we can really do to scar tissue. That's just a buzzword. Really all we're trying to do is hydrate your scar tissue. We're trying to soften your scar tissue and get more blood flow in there. Okay, so once you've gone right, left on all of them, come back to where you started. Now we're going to go up, down. Pull up, pull down. And yes, with lymph, we want to move everything up, but because we're just working in this one spot on your scar, we want your scar to be able to be pliable in all directions, flexible in all directions. So for right now, forget my teachings of pulling everything up. Pull the scar down a little bit, but just the scar. And even if you don't have a scar here, and this area gives you trouble, like let's say you get really bloated in this area, you might just have dehydrated fascia in this area, which we want your fascia to be pliable in all directions. And so that's why we're doing this. Okay, low belly, pull up and down. Skin stretch and down. It's still super light. It's the same pressure. I've done everything else. I'm just rocking back and forth to get this scar some hydration. We're getting blood flow in there. We're getting lymph flow. Think of a dried out sponge on your sink. If you went to go pick it up, it'd be pretty brittle. If you went to bend it, it would feel like it was going to snap in half. It might scratch your skin because it's so dry. Now imagine if that same sponge got wet. You could squeeze it. It would retain its shape once you let go. It would be soft. That's our goal with our fascia and our scar tissue. Okay, and then out to the side. So no matter how long your stomach is, widthwise, forward-wise, take your time with how much skin you have in this area. It's okay if we are a different shape. Just do the same thing. And you could do this with 2 fingers at the same time. Up and down. I'm just doing one for now. You could cover more surface area by doing this. So you can use your whole hands all the way across. I'm already feeling a decrease in my pain, so this is definitely sinking into the scar tissue deep in my ovaries and my uterus from my endometriosis. So just working the surface of my fascia is helping deeper into my organs, and that's why if you've had a hysterectomy or any surgeries deeper into the body, even if it's done vaginally, if you don't have scars on top from a laparoscopic surgery, maybe, like, so let's say if you had an ectopic pregnancy, if you've had a laparoscopic surgery, if you've had a hernia, you can work those scars right on top. But even if your scars are deeper into your tummy, hysterectomy, endometriosis scars, I've had multiple miscarriages, so I have scars from my DNC procedures. I've had 2 LEAP procedures, so I have scars from that. My low belly gets cranky because the scar tissue deep inside my uterus and my cervix and those areas and my ovaries. So this work penetrates even though we're working the surface of the skin. All right, the next one we're going to do on your scar is diagonal. So if you're getting my drift, we're trying to move in all directions. So fingertips, I'm going to go up to my belly button, down to the hip, up to the belly button, down to the hip. That one's tight for me. When I pull up to the belly button, that is the tightest I have felt this. And that makes sense to me because my ovary has a lot of scar tissue and I think it's stuck on my hip bone. So our organs can adhere to other organs. They can adhere to your bones. Your scar tissue can adhere to organs and bones. I'm going to change the direction. So I'm going to go this way and this way. I'm going to tell you a little story while you do this because I think you understand the concept of the movement now. So I've studied on cadavers in a cadaver lab with my anatomy mentor, and we had a cadaver lady who donated her body to science after she passed away. And in her 50s, she had had a double mastectomy. She lived a beautiful long life after that. And she passed away in her late 80s. And in her chart, we just knew that she was having right knee pain at the end of her life. So our teacher, my mentor, showed us, we're going to go a little bit wider, back on this diagonal now, to the belly button, to the hip bone, to the belly button, to the hip bone. So my mentor showed us that her scars from her chest went through her lungs, not around her lungs, inside her lungs like vines, wrapped around her spine, went down her spine like a vine, like a spiral, went down into her hip, went down into her knee, and was just pulling on her kneecap, like a little vine trying to creep into your house through the wood and the stucco. We're on diagonals, sorry. Switch your diagonal to the other way. That one's tight for me, that direction. So scar tissue can keep growing. I think of scar tissue like soldiers at war. They've done their job. They went to war for you. They put you back together. And some soldiers don't know that they've come home and that they don't have to go to war anymore. So some scars keep going to war and they keep growing and they keep expanding. And the more we do this kind of work, they stop doing that. They stop latching onto things around them, trying to hold on for dear life, because they still think it's their job to hold you together as much as they possibly can. All right, that's my long story. Up to the diagonal of my belly button and down. I'm super curious if you have a direction that feels tighter for you. Get to know your body. Get to know your scars. Even if you don't have scars, get to know your fascia. That's what we're working with. We're working with your fascia, your connective tissue. So I know that my fascia is tight in certain directions. Mine is tight when I go up towards my belly button, not when I go down. Let's go that way and that way. So I'm going this way and this way. And once we've done all these directions, you've really gotten to know your scar tissue. You've gotten to know which direction is tighter. I'm going to have you go back one more time for good measure and do the direction that's tightest. So for me, I found that my diagonals were tightest, closest to my hip bones. Those are the angles I'm going to work. I want you to go back, find your angle that was tightest for you. So for me, it was down here, and it was when I pulled up towards my belly button, because that is where I have scar tissue the most with my ovaries, my upwards pull. Yours might be something else, but let's just spend about a minute together working that scar tissue or your fascia one more time and working it in the direction that feels the tightest. And already I'm feeling less pain and less tenderness in this hip and then this ovary. Okay, if you want to go to another spot, if you found another spot that felt tight for you, but this is my two tightest spots. When I first laid down, I had this like brick of pain, like right here, like a brick in my stomach. It's already feeling a lot better. So I want you to notice how you feel. Hopefully you're feeling some improvement. Okay, maybe do one last spot. Maybe you're working the low middle to the sides. Place your hands on your low belly for just a moment. And I want you to send your low belly some love. Send it some gratitude. I think especially if you're a female, if you're a woman, most of my viewers are women, we have been taught to hate our low bellies if they're anything less than perfect. So let's send some love and some gratitude right here just for a moment. Your tummy works really hard for you. And especially if you've had trauma here, surgery here, if you have pain here, your tummy is trying so hard to keep you alive, to keep you fed. If you've had babies, your tummy has given you the opportunity to be a mom, to bring your children into this world. If you have not had babies, your tummy has given you the opportunity to be alive for yourself, because everything here keeps you alive. So let's just end with some brushing. I want to brush up. And you could do this super light. If you are closer to your period, go lighter and lighter. If you're on your period, go light. You can go a little heavier if you're not, but just don't make it hurt. I'm going to always brush up towards the sternochyli. I don't know about you, but I can be hard mentally on my tummy sometimes. And certainly in earlier ages of my life, I really hated my tummy. I love my tummy now, but even today, my tummy was hurting. It was bloated. I was annoyed at it. Really, it's just doing its job. It's trying to help us. And the more love we can bring to our body parts, the more supported and loved they feel. And our thoughts dictate everything in our body. If you hate a body part, your brain might subconsciously not send blood and lymph to it as much. So let's bring some more awareness and more attention to how we talk to our body, the gratitude we express, the love we express, because it truly changes our cells, it changes our health, it changes the cortisol, the adrenaline, it changes the trauma. Okay. Let's just end with a little Sister Nikaylee. If you feel swollen anywhere else in your body, you can do all 7 lymph nodes, but ending with this is perfectly fine. Let's make sure you drink a lot of electrolytes and water.